Do you hate math? Well, join the club. Let's go over the dosage calc basics and make it super simple. And you don't have to be a math magician to do them. See what I did there? Math magician. Okay, first up, what is dosage calc? Well, it's simply a way to calculate the right dosage of medication to give to a client. It's used to determine the right amount of medication based on the client's needs. So why is it so important? And why do nursing schools make you take an exam each semester for dosage calculations? Well, the main goal is to keep clients safe. Imagine if you miscalculate a client's weight or conversion of micrograms to milligrams and end up overdosing a client. Or maybe you miss one number and overdose a little baby in the pediatric unit by giving an adult dose rather than a pediatric dose. Trust me, it happens a lot in the clinical settings. Medication errors are one of the leading causes of harm and even client death in the clinical setting. Every year, thousands of clients die from a simple medication error. So remember, safety is number one, and this is why nursing schools are required to have dosage calc exams each semester. This is done to ensure patient safety. Now, there are 4 types of medication math, or dosage calculations, that you need to know for nursing school exams. And they are dosage calc, or formula method, the pediatric dosage calc, which is primarily weight-based, IV drip factors, or drop factors, and then metric conversions. Now, some key terms to know is desired dose, so that's the dose we want to administer to a patient. The next key term is total drug amount. This is the total amount of the drug within its container. Next is total drug volume. This is the amount of fluid within the drug's container. And the last one is administered volume, the amount of fluid in mLs we will administer to a patient here. So the most typical concentration of a medication we are going to see in the hospital setting is a concentration of milligrams per ml, or total drug versus total volume here. So use drug calculations when calculating the quantity of medications needed for a patient, and the strength of medication is already known. Now, sometimes it's going to get a little bit complicated. So sometimes concentrations are expressed as percentages. So how would you go about solving this type of problem? Well, no sweat. There is an easy way to do this. So let's look at lidocaine 2%, which each ml contains 20 milligrams of lidocaine hydrochloride. So just take the percentage, 2%, and make it grams. So 2% is 2 grams. Take the number of grams and place it over 100 mLs. So for example, we have 2 grams over 100 mLs, so that is 2,000 milligrams over 100 mLs, and then divide it. So we get 20 milligrams per ml. Now for the NCLEX, the need to know here. Calculations are used in medication administration, including household measurement system, aka baking a pie method. Wink, wink. So the metric system, or apothecary system, all medication dosages, regardless of the type of calculation, will have these 2 components. A medication dosage prescribed by a healthcare provider, an HCP, a medication concentration provided by the pharmacy. So for example, the desired amount, or basically doctor's order, is a D. This is the amount of medication prescribed by the provider. Now the amount on hand is the dose on the container label. And lastly, the volume, the V, or basically the quantity, the Q, is the form and amount in which the drug is supplied, either a fluid, pill, or capsule. So for the formula method, I just simply use the memory trick, drinks are on the house times the quantity. So let me show you how this works. D is for drinks. This is D for dose ordered, or basically doctor's order. H goes under like it's on the house here, which is what you have H on hand here, or the medication in the cart. Then simply X is for times the quantity, or basically the volume here. So on the NCLEX and nursing exams, you can get a question like this. Administer digoxin 0.5 milligrams IV daily. The drug concentration available in the pharmacy is digoxin 0.25 milligrams per ml. How many mLs will you need to administer in a 0.5 milligram dose? So let's simply set up the formula here. Like this, D over H times quantity equals the dose. So remember, drinks are in the house times the quantity. So the desired amount, the D, 0.5 over what you have on hand, 0.25, times the quantity of 1 equals 2 mLs. So the correct answer here is 2 mLs. Now moving on to IV drip rates, or IV drip factors. The memory trick is to set up the formula. So we have TV for total volume times DF for drip factors over time, which is 60 minutes, unless we're using a pump, and that's 1 for 1 hour. Now, the simplest way is to remember this drip rate formula is just by saying TV makes you deaf over time. Just like your mother would always tell you to turn down the TV when it was so loud. So on your next medication calculation exam, simply write out this formula. TV makes you deaf over time. And trust me, you're going to get every single question correct every time. Now, for specific examples, we break this down in the individual videos on IV drip factors. Okay, now for other IV medications, they look slightly different because you have to do the conversions, or some conversions, prior to putting the information into the universal calculation. You must consider the drug concentration and then figure out how the drug is being measured. Is it in units per hour, milligrams per hour, milligrams per minute, micrograms per minute, or even the most complicated, micrograms per kilogram per minute? Oh man. Okay, now I know this looks daunting, but it's really simple. Depending on how the IV drug is ordered, just use one of the following formulas to get the answer right. So for example, let's break this down. The IV is running at 8 mLs per hour. The label on the bottle reads 50 mGs over 500 mLs in sodium chloride solution. This is our normal saline. What dose of nitroglycerin, micrograms per minute, is the client or patient receiving here? So let's set this up. 50 mGs over 500 mLs times 1,000 micrograms over 1 mg, the milligram, times 8 mLs over 1 hour. And finally, times 1 hour over 60 minutes here. So once we do all the math and division and multiplication here, the answer is 13.3 micrograms per minute. Really, the key is to set up the formula correctly. Now, moving on to pediatric dosage calculation. So the patient's weight is always a factor when administering medications to children of all ages, especially the babies. So doses are often expressed in milligrams per kilogram per day or milligrams per kilogram per dose. Trust me, it's really easy to overdose a little baby or a child. So for example, let's break this down. The provider orders 200 milligrams of Benadryl per day for a child who weighs 98 pounds. But the safe dose here for Benadryl is 5 milligrams per kilogram per day. So the question's asking, what is the safe dose for this child? Okay, first things first, convert the pounds. So 1 kilogram equals 2.2 pounds. So 98 pounds divided by 2.2 is 44.45 kilograms. And then this is really simple. Just multiply 5 milligrams times 44.45 kilograms. We have 222.5 milligrams per day. That is the max safe dose. So ordering 200 milligrams per day is way under that. It's safe for the child's weight.